Hi, I wanted to make this video to give you some information about what is the Phoenix Rising Center. So first and foremost, the Phoenix Rising Center is a not-for-profit organization. That's very important for you to understand because I believe it's the only one in Ontario. So the Phoenix Rising Center is geared or specializes in drugless cancer care. Why is that important? Because it gives people choices to what they can do towards their cancer care. If they've had a medical diagnosis of cancer, here is an option to be able to use homeopathic medicine and natural protocols for drugless cancer care. I'll talk a little bit more about homeopathic medicine as I go on in this video. So I want to just make sure you understand, I am not a medical doctor, I'm a homeopath, regulated under the Regulated Health Professionals Act. So take a minute here. Just think for a moment. What if we are looking at curing cancer the wrong way? What if we really should be looking at why cancer cells started to mutate and deal with that issue instead of the end result being the cell has already turned to cancer? I bring this point up because billions of dollars have been poured into cancer research and the battle is still going on. Maybe it's time to change the approach as to how we look at cancer, and thus the Phoenix Rising Center. So again, what is the Phoenix Rising Center? It is a center where all people will have access to regulated health professionals who believe in a holistic approach to drugless cancer care. And an individual program will be made for each person based on their specific needs. A place that is out in the country on 100 acres where you will first attend the clinic, a friendly home atmosphere, and in the clinic, different natural approaches could be used towards the drugless cancer care, but the primary one will be homeopathic medicine. The second building will be a retreat center where people can come for overnight up to 30 days of a stay, as well as a center where counseling on all levels will take place. Counseling for the mental emotional state, as well as the physical state. The third building will be an auditorium where speakers will be brought in on a regular basis to educate and provide information for those that would like to attend a specific workshop, concert, or event. Firstly, I want to talk about homeopathic medicine. Millions of people take homeopathic medicine. Yes, millions of people worldwide. So on a logical approach, do you think millions of people will continue to take or would continue to take homeopathic medicine if it didn't work? It has been around for hundreds of years and in fact was the first regulated medicine in Ontario. I want to share two patient cases. I could share a lot more, but let's start with these two. The first one, and I'm going to try and keep this as short as possible. Person with cancer, doesn't even matter what cancer it is. They had chemotherapy and radiation, and the cancer returned. They had a stem cell transplant, and the cancer returned. Then they went to Mexico on 2 occasions for a month at a time, and the cancer returned. They came to see me in September of 2013, and today they are alive and well. The cancer returned 3 times after chemo and radiation, after a stem cell transplant, and after going to Mexico for treatments. The cancer returned. So in September of 2013, this patient started to come to my office. And today they are alive and well. And in fact, they are expecting a child. That in itself is a miracle. I want you to understand that when this person had the stem cell transplant, it put her into menopause, and now she's expecting a child. The only 2 protocols, the only 2 differences that this person took were homeopathic medicine and a topical herbal salve protocol. Those are the only 2 differences from all the other protocols that she had done throughout her journey of cancer. So those 2 things made the difference to her. You have to think about that. Homeopathic medicine and a topical herbal salve protocol. Those were the only differences. And it's the end of 2016 right now when I'm making this video. She came in September of 2013 and alive and well today. The second patient had breast cancer, did the traditional scans and tests. No other cancers were present before she started her treatments, and she was healthy, including a stress test before she had started chemo and radiation. While she was doing chemo, she had a heart attack. She had her radiation, and then months later, the cancer returned. But the cancer returned as lung cancer. And coincidentally or not, it was the lung cancer is in the same spot as where she had radiation. I can't say that it's because of the radiation. I'm just saying it's kind of a coincidence that it is exactly in that spot. She was actually diagnosed with small cell lung cancer. And if you look that up, medically, a diagnosis of small cell lung cancer doesn't have any cures medically. Pharmaceutically, it doesn't have any cures. And it is actually an aggressive form of lung cancer, and life expectancy is very short, a year to a year and a half. So this time she decided not to do chemo, and she started to use homeopathic medicine. And one of the major things that she also used was a protocol called liposomal encapsulated vitamin C. So it's now been 16 months and she is alive and well. Now, there's many different natural protocols, but not all natural protocols are good for everybody, nor do they work for everybody. So you have to find the solution that works for each individual person. But in my opinion, the number one thing that has to be used is the homeopathic constitutional remedy. So a constitutional remedy in homeopathic medicine is you. It is your mental emotional state, your personality, and your symptoms combined for that one homeopathic medicine that matches that. In my opinion, that is one of the key elements in drugless cancer care using homeopathic medicine. In October of 2015, I visited a hospital in Lucca, Tuscany. They incorporated homeopathic medicine into their publicly funded healthcare system. I wanted to stress that, publicly funded healthcare system. They did a 12-year qualitative study that showed 20% of their patients reported the complete issue was resolved. 27 significant improvement, 22% good improvement, 21% slight improvement, 10% no change, and only 0.5% a slight worsening. So homeopathic medicine was very effective physically, working with physical issues. In this study, they actually did men, women, children, and cancer. They did a broad-based qualitative study in this study. So let's talk about cost effectiveness. The overall patients reduced their overall costs of using pharmaceutical medicine by 63.57%. That equals billions and billions of dollars that you and I pay for in our healthcare system. That adds up to billions of dollars that was saved using homeopathic medicine. The hardest part about the whole transition of using homeopathic medicine in the publicly funded healthcare system for Lucca, Tuscany was actually educating doctors to use homeopathic medicine. Well, here in Ontario, we don't have that challenge because we actually have homeopaths regulated under the Regulated Health Professionals Act. And in that act, the number one priority for the Ministry of Health is that we work together for patient-centered care. And in the policies for the College of Physicians and Surgeons, under their bylaws for complementary health, they actually are supposed to work with people like me, that homeopaths that are regulated under the Regulatory Health Act. And in fact, you as a patient If you ask your family physician or oncologist to work with a complementary health therapist that is under, or practitioner that is under the Regulated Health Professional Act, they're actually mandated to work together. You need to know that because that's important for you to have the best care. I believe it's time for you and for I to have a voice and our opinion to be voiced and to make it known that we have these rights under the Health Act and that we need to utilize those rights. By the way, you and I pay for our healthcare system in Ontario with our tax dollars, so shouldn't we have an option to how we spend those dollars? And if homeopathic medicine has already been proven in a publicly funded healthcare system to be able to show that it worked on specific physical issues and it was cost effective, doesn't it make sense that maybe we should incorporate it into our publicly funded healthcare system? I consider myself to be an average person, but an average person with a purpose. You and I, the average people, can join together and we can make a difference. We really can. Make some noise, share the video, tell people, talk to your member of parliament, and remind them that we actually pay their wages and we pay for our healthcare system. As I stated, the Phoenix Rising Center is a not-for-profit organization, and it operates solely by donations. Donations that come from ordinary, average people making a difference. I have averaged the cost out for a drugless cancer care patient to be around $8,000 for approximately 12-month period. And that's only an average. So $8,000 provides the opportunity for someone to receive drugless cancer care. If you want to be part of a group who want to help others to have a choice for their cancer care, please follow your heart and make a donation. All donations will be provided with a charitable tax receipt at the end of the year. Already, the Phoenix Rising Center has had people giving donations on a monthly basis, and I and the board are very grateful for each donation. But more importantly, the patients are grateful for the donations. Thank you for caring. Next step for the Phoenix Rising Center is to move to a bigger facility. I need to be able to train more staff to handle the patient load. Can you help us build a bigger facility? Donations can be mailed to the Phoenix Rising Center at 603 10th Concession, Hagersville, Ontario, N0A1H0, or go online to make a donation at www.phoenixrisingcenter.ca or .com, and center is spelled CENTER. Together we can make a difference. I do not think that there is any facility in Ontario that does drugless cancer care and is covered by donations. Together, we can start to make the changes toward cancer care. Thank you for listening, and please share.